Now we go to the second session of the day, and this is about 50 millisiemens potencies and naturally related to organ or medicine, and that is 50 millisiemens potencies. In short, we write LM potencies. It is easier to write, easier to type. That is why instead of writing a long 50 millisiemens and getting your spelling tested, it is very good to write LM potencies. I was fond of writing incomplete 50 millisiemens potencies. I have now stopped that. I write LM potencies. Now LM potencies we shall study today under these many heads, as you can see: background, purpose, process of potentization, process of administration and the 3 stages therein, then advantages and fruitfulness and disadvantages. All of us are well aware of centesimal and decimal potencies, and the 50 millisiemens potencies we have studied when we were students, and at that time it was argued about 6th edition, whether 6th edition is genuine or not, and there were 2 schools. One school supported the 5th edition and second school supported the 6th edition, and after a long discussions, after quite a few years, the issue is now resolved. Now there is no doubt that 6th edition was written by Hahnemann only, and about that there is no confusion. Some small points here and there, because that manuscript was misplaced, and that manuscript was not given by Milani because she wanted the royalty which nobody was prepared to give. The history aspects I am not going to talk here, but the reality aspect is that 6th edition ultimately came to the notice of the world in 1921 when it was published by Boric. By then many of the senior homeopaths about whom we talk, with whom we are influenced and connected, including Kent and Kochhar and Bering and all others, which in era you can see, they were not there. That means they practiced without the knowledge of 50 millisiemens potency, without the knowledge of 6th edition, without the knowledge of repetition of the doses in potency. So whatever they said was an incomplete thing, which we at this point we have already covered in neoteny. So that is, there is pedogenesis. If neoteny takes place, then the growth is small and the species does not develop fully. So Hahnemann's ideas were not fully known. Now if we want to use it, we should understand 50 millisiemens potencies and should try to use it and see it. Now it is revealed with Organon of Medicine 6th edition, published in 1921, which we have already discussed. Then Hahnemann's effort always was to cure in mild and rapid way. Whatever changes, 1st edition, 2nd edition, 3rd edition, 4th edition, he kept on making changes. Now he was not making changes only for the sake of selling editions, because those days that was, people were of a different caliber, people were of a different type. If some new revelation is there, then that should be published. But what was the target of that? Did he change the major things? Did he change the law of similia? Did he ever say that instead of similia something else also can be done? Then law of minimum? No. Law of simplex, instead of 1 remedy use 2 remedies, 3 remedies, did he ever say? No. What he entirely concentrated was on 2 things. One was dosages, quantity of medicine, and second was causes. Causes is not the area which we cover here. We talk of the doses. So it is for mildness and rapidity. Doses are to be controlled for 2 things. Medicine is correct thesis. Now what happens today, that many of us spend so much of their energy in selection of medicine that we seldom go to the next stage. First stage itself we get stuck up. Now if you are very sure about the first step or reasonably sure of the first step, there are so many things. और भी गम है ज़माने में मोहब्बत की सिवा. Where it says that apart from love there are thousands of more difficulties in life. So that means that after first prescription there are many more problems. So here that is 50 millisiemens potency. Second point which I have covered here, mild and rapid way is the target what Hahnemann chose. Now aphorism 246, be it edition 5, be it edition 6, it says, it emphasizes on these things that duration of cure must be made shortest, and it can be made shortest by, first of all, medicine must be homeopathic, that is, your selection should be correct. Second is, dose should be highly potentized, that means crude substance should not be given. Low potency or high potentization, between the two, if the choice is there, it should be highly potentized. In 6th edition he adds the word in water. Then suitable interval repetition. Up to 4th edition, the question of repetition Hahnemann did not talk. We saw in chronic diseases the revelation of miasm and the coverage to chronic diseases. Whereas earlier, before this coverage, Hahnemann was prescribing in his own method, and single dose was doing the work. And many times people identified Hahnemann's homeopathy with a single dose therapy. Homeopathy means a single dose is there and it does the work. There is a surgeon who is a friend of mine. He said, I told to my patient which I referred to you that when you take medicine from Dr. Kochhar, if within his first prescription you are relieved, then you are relieved. If you are not relieved, then there are less chances of relief. Now this is an old idea, because mostly what happens that first prescription single medicine does the work, but that is not, Hahnemann found that that is not homeopathy. Otherwise later on also he would have concentrated on that, giving single medicine. He finds that in chronic diseases the medicine has got to be repeated at suitable intervals. And in 6th edition he adds something more, and that is there should be a slight deviation in dose, in potency. That means if you are giving first potency, then second time it should be second potency, third potency, fourth potency. This is possible in 50 millisiemen, because 1, 2, 3, 4 up to 30 there are potencies. Nowadays there are some persons who have some shops, some centers which are potentized up to 60 also. But in centesimal what is happening? You give 6, then after you give straightway next 30. After 30, no stop, 200. After 200, no stop, straightway 1. So in this way the gap is not slight, the deviation is not slight, deviation is substantial, but this was not known. So this is what is written in 246 aphorism. Next point is slightly deviation. Then concern with aggravation. Background of 50 millisiemens potency discovery is Hahnemann's concern with aggravation. Hahnemann was very much disturbed with the similimum causing aggravations. Many times in initial part of our practice, some of us say, I have never seen any aggravation. It is very difficult to tell him that you have never prescribed any correct remedy. We cannot talk like this, because that is antisocial talking like this. But then it can apply to ourselves also. As we find more and more acute prescriptions, more and more correct prescriptions, more and more similar medicines, and the conditions also, sensitive patients also, we find tremendous aggravations, and which sometimes all of us are aware that patients are very much afraid of aggravation. Even if there is no relief, we don't mind, sir, but there should not be aggravation. Otherwise, what happened earlier, a generation before me, I have seen in my practice, patient would say, homeopaths are very cruel people, Dr. Kochhar. I said, why? I told to doctor there is aggravation, he was very happy. He says there is aggravation, no worry, your patient will be alright. What a cruelty he says. I told him it is not cruelty, aggravation is, Hahnemann himself has said that when there is a slight short aggravation and quick aggravation, that is a surety that the medicine has acted. But that observation is specifically limited to centesimal potencies. Hahnemann said, and we can see in our practice, that 50 millisiemens potencies do not cause aggravations. So that is the background. And then uniformity in potency. Uniformity in potency means he said it is from 1 to 30. So rather than, because at the time of Hahnemann itself very high potencies of centesimal some people were making. So he said that when we are all of the same profession, then our tools should be uniform. That means our experiences can be shared. So that was another point for which he chose these 50 millisimal potencies. So this is the background. Then we go to the purpose. Now purpose, why? Apart from background, what is the purpose? One is to raise the dynamic strength of the medicine. That is, the dynamic strength, that is, medicine has got a hidden power, latent energy is stored in a crude substance. And what is potency? We have studied in pharmacy that the inherent dynamic power of the medicine is released. Now here this very thing should be released or is released more than in centesimal. So first is to raise dynamic strength, then at the same time, and how it is released? Because you are giving 100 strokes instead of 10 strokes in centesimal, here you are giving 100 strokes, so you are liberating more energy. Second is reduce duration and intensity of action of medicine. Duration is reduced. Centesimal 1M potency may act for 6 months, may act for 3 months, may act for a very long period, but the intensity can be violent, aggravation can be violent. So here duration is reduced and intensity is reduced. If the duration is reduced, the solution is that you are repeating it. You are repeating it. What is the action of homeopathic medicine? The duration of homeopathic medicine is much more long than many times the allopathic medicines, which are the palliative medicines. There are of course two types of medicines. Nowadays there is no use comparing or discussing about advantages or disadvantages of homeopathy and allopathy, because allopathy is a science in itself. Let us not talk like that, but let us talk like this, that even after reducing this action is strong enough. But in order to avoid aggravation, the purpose is reduce the duration, reduce the intensity, that is regulate the medicinal dynamics. That means your weapon should be under your control. In a sensitive patient, you can control it. And third purpose is enable repetition without aggravation. So that is the corollary of the first two. So this is the purpose of raising the dynamic strength of medicine, regulating the medicinal dynamics, and repetition without aggravation. Because centesimal also many people are repeating. I know once I was standing in front of a shop, homeopathic shop of my friend. So what he did, somebody came, read in a newspaper that Lycopodium 10M take 3 times a day
6 months.
for 6 months. But don't talk. There are many persons who do it. Many persons who do it. Many persons. Yeah. No. But then what had, I am telling the story that what had happened, that I wrote I wrote some high potency and 1 dose. So what he did, he gave him 1 ounce. So I went to tell him that look here, 1M, 10M, CM potencies, 1 dose is to be written. A very wise fellow. He said, accept for a ruko. Wait. Then in the meantime, the prescription came. So the patient was asking how much will be required. Then he calculated. He said, you take 4 ounces. 6 months, every day, say 10 pills or 8 pills, thrice. So how many pills in a day, how many pills in a week, how many pills in a month, how many pills in 6 months, and sometimes peeling, etc. will be there. So then he, after the patient went, he said, sir, you should please write clearly. Your handwriting was not clear, he says. Your dose, D-O-S-E, you write clearly. Now how do I understand whether somebody needs 1 dose or somebody needs 4 ounces? Now this particular thing, that is repetition, centesimal is not advised, but people are doing it. and when people are doing it, they are suffering from irreparable damages also, but sensitive people. So here repetition is enabled without aggravation in 50 millisiemens potency, right? Then process of potentization. This we have studied during our student life, and we will just focus it again for our recap. That mother tincture, they say, Hahnemann says tincture, he doesn't say mother tincture, but to make clear I have written compare with centesimal mother tincture. The first third potency of all medicines, no drug groups, all medicines are to be triturated, and 3C trituration is to be made, that is 10 raised to the power minus 6, 1 is to 10 upon 6. Then dissolve in 20% alcohol, how much? 1 grain in 500 drops, and then that becomes the first potency, mother potency or the tincture potency. Then first potency is made, that take a drop of the tincture, add 100 drops of absolute alcohol, that is ethyl alcohol, give 100 succussions, then moisten with small globules, number 10 globules, and spread on a blotting paper to dry, on a piece of paper to dry. Then store the globules in tightly supported little phial or vial with the sign of first degree of potency. Some people write M1, some people write 0 upon 1. So M upon 1 millisiemens and 0 upon 1 is 0 is the sign of globule. Now this I have specifically recorded here because when I started my practice and when I was explained, when Professor Day, Dr. Day, he in fact sent a kit of about 25 common remedies to me to use 50 millisiemens potency in potency 3 and 5. So after the action was there, then you don't get next potency easily, so you have to make it yourself. And I found that initially this process was very handy, and this has to be understood for that purpose. If you can get a shop where next potency can be obtained, those of you who are practicing in Bombay will get it in Bombay, now it is available. I don't know about Pune, what is the position, whether 50 millisiemens potency is available or not, all potency is available. So Nagpur also nowadays this is available. But then this process we should know, so that we are not, we should remember rather, so that we are not stuck up, and like that and so on, from first to second to third and like this. So this is the process of potentization. The next thing comes is process of administration. How to administer once the potency is there. So here remember one thing, I have written here 1 teaspoon is equal to 3.5 ml. Because teaspoon nowadays is an outdated this thing. So it is 3.5 ml. You can ask the patient to take 5 ml. And 1 tablespoon is equal to 15 ml multiplied by 4, because in fact teaspoon is 3.75. So it is rounded to 3.5. Now 1 globule in 7 to 8 teaspoonfuls of water, says Hahnemann. Now here interestingly the Duggan's translation of 6th edition, Boric Duggan translation of Hahnemann's 6th edition, and that of Stephen Decker or this Venda Orelli, you find that the Venda Orelli's this particular version is more clear in the use of these tablespoons, etc., etc. It is more clear. Whichever source you read, the substance is this, that 1 globule in 7 to 8 teaspoonfuls of water, then give either 8 or 10 or 12 succussions, tell to patient to give, because it depends on the sensitivity of the person. If you want more power, then the patient can give 12 succussions also. Then give 1 tablespoon in 7 to 8 tablespoonfuls. That is diluted about 8 times. Then from here, give the desired dose. That is, you may give 1, you may give 2, depending on the patient, 1 teaspoonful. Then in chronic diseases, it can be given either once a day, daily once, or alternate days. Whether it is a very deep acting medicine, Nozode also, that can be given daily, that should be given daily, because the action becomes mild because of this potency. And in acute diseases, you can give 2 to 6 hourly. That is nearly 4 to 8 doses in a day, depending on the condition of the sickness, that is the type of the acute disease. Now here also aggravation can occur, because oversensitive person, aggravation can occur. If aggravation occurs, it is easier to handle. In centesimal you have no method other than antidoting that medicine, and that antidote, or either antidote the medicine or lose the patient, because in the race of today the patient runs away after your aggravation, he never comes to you. So here it is, the aggravation is controlled, and it can be controlled that the methodology is, in chronic disease, stop the medicine for 2 to 4 days. Stop the medicine for 2 to 4 days. And in acute diseases, because repetition is more, so you can stop for a few hours, 4 to 6 hours, don't repeat. The aggravation will pass off, because the action of the medicine is of short duration. You have already reduced the duration of action of the medicine by adjusting the dose. Then after that you apply higher potency in more diluted form, and that more dilution can be done like this, that you ask the patient to take 5 ml in about, say, 7 to 8 spoons, about 120 ml multiplied by 15, so 120 ml, and you give 1 teaspoon or 1 tablespoon. Then from there stir it well, and from there take 1 teaspoon and put it in another cup. So that is called, this is second serial dilution. I have seen patients in my life wherein I have been required to go up to third, fourth serial solution also, serial dilution also. This is in skin disease, and this is in oversensitive patients, maybe joint pains or maybe different conditions. You may come across it, you may take it. Then there are other people. There are other people, like a friend of mine, I won't name him. He says, I never ask the patient to dilute. I ask him to take the entire half cup. Fortunately, he has not faced any aggravation. I don't know, I have not met him recently, what is the status. But the other day I had a patient, and he said, Aksab, your dose, it was not very difficult, it was not very easy for me to throw it. But he was a businessman, so these businessmen, they hardly have they have very great difficulty in wasting. So he thought that instead of wasting, it is better I should drink the entire thing. And he says, I am better with that, Aksab, your dose was not correct, so your dose should be like this. I said, alright, see. Afterwards there was some aggravation. So he came. He said, yes, there was aggravation, but that was controlled. Now again I am taking full dose. So yesterday itself we had a compromise with him that you will take half of the liquid and throw the half. So see, this is individual to individual. Every individual is not going to have this aggravation. But you are an expert in individualization. You have to face the difficulties of the patients from patient to patient. So this method is available. Here you can use second or third serial dilution, where 1 teaspoon in glass with 8 to 10 tablespoons. Then there are 3 stages now. Now let us mathematically calculate these 3 stages. First stage is from bottle to mark. If there is a bottle of medicine, I'll just show you the bottle of medicine. Just a minute. Yes, I'll show you this bottle of medicine. So in this way, from bottle of medicine to the mark, that is, you have put marks. These are the marks, 1, 2, 3, 4, 5, 6, like that. You have put marks, 1 to 14 marks, 1 to 16 marks. So 1 to bottle to mark, Henneman says, make 8 marks. Now 8 marks means from 120 ml to 15 ml. This has been reduced to ml, and this can be modified depending on your need. If you know the mathematics, if you know the dilutions, you can convert it. Instead of 120 ml, if you take 16 ml, 60 ml, then you have to make 7.5. Stage 2 is from mark to cup. Now this mark will be diluted in cup, and cup again dilution is 1:8. That is 15 ml is put in 120 ml. So there is another 8 time dilution. And third is cup to spoon. From that cup you are asking the patient to take spoon, and that is dose. So here it is 24 times recommended by him. That is 120 ml to 5 ml. Now if you understand this fundamental, one is 8 times, second is 8 times, and third is 24 times. I have calculated the product for you, and the product is multiplied 8 by 8 by 24. So that comes to 1536. We have reduced it to over 1500 times. Now it will not matter much if it is 1400 or slightly, because of practical difficulty of the size of the bottle, size of the spoon, understanding of the instruction. So this is the 3 stages which we have seen in a calculated manner. Now after this we go to the final stage of advantages and disadvantages. This has been taken from Dr. Day's book of Essentials of Principles and Practice of Homeopathy. Now Dr. S.P. Day sir says here that aggravation is kept at minimum, first advantage, and first fruitfulness. Minimum aggravation is caused. Second is useful in skin cases. Then in difficult and serious cases, in organic diseases, and even in some acute diseases where aggravation is possible. Then deep acting medicine like Lyco, Calcarea, Sepia, including Kalikarp, for which Killer's aggravation one can describe. Now such deep acting antisorics also can be repeated every day. Then indicated remedy can be used for palliative as well as curative purpose, because what happens when you want to use as palliative remedy, that means advanced tissue changes. Then in advanced tissue changes in centesimal there is a fear of aggravation. So what you do, you prescribe a mother tincture separately for that, because it should act and it should not cause aggravation. In 50 millisiemel potency you can select the simillimum and give it in 50 millisiemel potency. It is the state of the body which is going to decide what reaction to give, because palliative reaction is nothing but short action, and here curative also is short by long repetitions. So for palliative conditions also same potency can be used. Then in long standing chronic disease the duration of treatment is reduced substantially. It can be reduced to half, to 1/3, and even Hahnemann has said that, and even we find it in our day-to-day practice. You see the cases which have been described by our stalwarts, where sometimes the patients have been treated for 1 year, 2 years, 3 years, 4 years, long duration, and then they got the relief. Now because that is with centesimal. Here with 50simal the period is reduced drastically. Then action of medicine can be adjusted quickly, whether your prescription is correct or not. In centesimal it is going to take a long time. Wait for 15 days, wait for 1 month, then you come to know whether action is there or not. It is a different thing that if your intention is only to earn money, primarily you are happy because you earn money as long as the relief is not there. Because one of my friends, he said that Hahnemann's 12 observations are there. I'll tell you my 3 observations. So there are 3 observations of my friend, and these 3 observations are: first observation, after homeopathic medicine there is aggravation. So when there is aggravation after homeopathic medicine, no problem, patient knows, patient is happy, so first advice, he continues treatment. Second is, there is no action. He says, alright, homeopathic medicine takes time. Homeopathic medicine is going to take time. As long as time is taken, so long as money is also being coming. So no problem. Third is, there is relief. So what is the problem? If there is relief, so all 3 observations are good. That is jokes apart. In reality, the action of medicine, we want to check whether the medicine has acted or not, and we have no way to know whether the medicine has acted or not. If it is your own relative, your own person, over there you will not be thinking commercial. Over there you will be thinking about the real target in mind. And here, centesimal potency cannot tell this to you. Whereas the 50 millisimal potency, LM potency, in 2 to 4 days, slight action will be there. You will be able to judge it. And in acute disease, in a very short time, you will be able to know, 2 to 4 hours. In mental diseases, even low centesimal potencies can sometimes cause aggravation, because at mental level if you give a polycrest remedy, patient is already in turmoil, so there is an aggravation which is prevented in 50 millisievert potencies. Chronic long duration suppression, sometimes there is suppression of long duration and you give the centesimal potency, after that it takes a long time for that suppression to come out, and you know without the suppression coming out, if the chances of cure are not there, here it can be revived easily because you are repeating again and again. Then primary stages of SORA, psychosis, syphilis, Henneman has said that you have to give larger doses here. So here instead of dilutions, full mouthful doses are given in primary stages of SORA, of syphilis and psychosis, and repetition is easily managed. LM potency is unavoidable for ideal repetition is the summary. Disadvantages, like everything having advantage, there are disadvantages also, but disadvantages are very few. One is dispensing difficulties, to get bottle, to get alcohol. These are the difficulties which we come across. There was a time when the shops, medicine shops, were not giving us alcohol. We said, you give us this placebo. They said, oh no, we cannot give placebo, because in between our country faced a problem. In UP there were homeopathic medicine shops were used for selling alcohol. What they did, they filled all bottles with Brionet 200, Naxomega 200, Econite 30, and that was the liquor. And they sold it. So government put a ban on that, and government put a ban on dispensing initially the 1 pound medicine also. They said medicine can be sold only in 30 ml, 60 ml. So all these problems, now much of it is solved. Now it is available to genine people. So these practical difficulties are there. You have to apply for a license of alcohol and you get a license. So whatever is the point is that these are the dispensing difficulties which keep on changing from time to time. One difficult, but every difficulty has a solution, right? So this is one disadvantage. Second is, if the patient is outstation and far away, then to regulate, to adjust, to send the liquid medicine, because nowadays due to terrorists, these liquid medicines, the speed post doesn't accept, the air carrier doesn't accept, it has to go by surface transport. So that difficulty is there, but then again we have solutions, because there is surface transport and we can send it if we want to, but this is a difficulty. But advantages overweigh, that is, are more in excess than these small difficulties. So we have to get rid of these difficulties and go ahead. So this is what I have to tell you about 50 millisievert potencies.